Hello. Today I'm really excited to discuss collagen products with you. What is a collagen product and what are the different brands? A collagen product is basically a scaffold of collagen, and what it does is it lays a framework for good growth factors to help with wound healing. I use this on a lot of my chronic wounds. But before we get into what a chronic wound is, let's talk about what acute wound is versus a chronic wound. Acute wound generally happens in the first 30 days, whether it's from a pressure ulcer, a traumatic wound, surgical. Once you get beyond 30 days, it generally starts to fall into subacute or chronic phase. For me personally, clinically, I look at 3 months as kind of the defining period. We start getting beyond 3 months is when we're out of that acute and subacute phase, and we're into the chronic phase. So when do we not use collagen products? So there are collagen products that come in a whole different slew. The one that I really like is Cutimed Epiona. It's made by BSN. There's a product called Prisma, which is another fantastic collagen product that I use. There's Colactive Plus, there's different patterns. So let's talk about when you shouldn't use this. Well, if you have a heavily draining wound or an infected wound, you can't use this. This is really meant for mildly draining wounds to moderate draining wounds. So usually in the acute wounds, they have moderate to heavy drainage. So you really can't use collagen products in these type of wounds. As we discussed in previous episodes, such as hydroferablue, aquacel, and alginate, those are great for those wounds that need absorption. The most important thing is get rid of that biofilm and the drainage. Once you start minimizing that drainage, we can start getting into the healing phase. You want to really get out of that inflammatory phase or the contaminated wound phase where there's a fair amount of bacteria and a fair amount of drainage. Once you do that, you can start migrating to other products. You can use gels. My preference is always going to the collagen route. This still does some sort of absorption. It's a sheet. What's nice is, as you can see, it's perforated. Prisma is another one that comes in a sheet. It's very easy to rip off. You don't need scissors. A lot of people like to cut with scissors. I'm kind of barbaric. I like to kind of rip. This one's very nice because it's perforated, so you can kind of cut in different lines, as you can hopefully can see on the video. This one's really good. It does absorb. It gets absorbed by the body. It lays a matrix for healing, meaning that it gets absorbed by the body and lays good growth factors as well as minimizing bad inflammatory factors. So this is a product that's generally used in different wounds, whether they're venous stasis ulcers, vascular ulcers, or pressure ulcers, after we've minimized and really curbed the drainage and the biofilm, as we've talked about in previous episodes. So it's not uncommon. Well, I have a wound in the first 30 to say 80 days where I really try to get the drainage down. I'll do debridement. I'll use either an alginate dressing, aquacel, or hydroferablue. Sometimes I'll use negative pressure therapy with the vac. Once we get the drainage down, it really starts to heal. Then I'll start migrating to the collagen products. Sometimes I'll use a collagen product such as this in a wound that has depth with aquacel or hydroferablue on top just to fill in the cavity. Remember, we talked about you can't just put a dressing on top of a wound if there's a significant cavity, meaning a wound that has depth. If it has depth, you have to pack the entirety. You want the wound to heal from the inside out as opposed to the outside in, meaning it has to heal from the base or the bottom. So these can be used on flat wounds. So let's say I have a woman that has a venous stasis also that has minimal drainage and it's flat, I can put this right on and that's it. You cover it and you do your compressive wrap as we've talked about before. If I have a wound that has significant depth, meaning there's a cavity that's this big, and I'll try to show a picture, I'll put this at the base and try to fill in as much. You can layer and stack this. I'll show you what I'm talking about. I'm going to open this up. These products are generally not cheap, but that's okay. I have a sample here. As you can see, it rips nicely, very easily, and you can stack this. Now, obviously, I'm not using gloves, I'm not sterile. You can kind of lay this in different layers. I'll show you. You can stack this in. You can put it in a tunnel area called undermining, meaning there's with the part of the wound that you can see. There's an area underneath the skin. You can pack this, and it works great for that. It's not uncommon that I use this with negative pressure therapy, meaning if there's undermining, I'll put this inside the undermining area, and then use hydroferablue or the black foam with negative pressure therapy. This works great. Usually it's changed every day when there's moderate drainage. When the drainage starts to come down, I generally change it every other day. Some people really push for every 2 to 3 days. I start every day just to make me feel comfortable. Once the drainage really starts to ebb, then I go every other day. It can be used with any sort of secondary dressing. Sometimes I'll use a foam, such as hydroferablue, or I'll pack it with aquacel if it's a deep cavity. Sometimes I'll just put a foam dressing on and then cover it either with a waterproof dressing, gauze, or some sort of wrap on the leg. I'll do a wrap such as kerlix, which I'll show you in another video what that is. It's basically gauze that comes in a roll. The most important thing is when you change it, you still have to irrigate the wound and clean the wound and perform good aseptic technique to clean the wound. If you're not changing every day, every other day is fine, but you have to make sure you're cleaning it. Now, sometimes there's good, we'll say, growth factors that are stuck to the wound. You want to rub those off. You just have to know what the difference is between drainage and from the collagen matrix, which is coming from these products, whether it's Epiona or Prisma. As I said, in summary, these are really great products for chronic wounds. I really recommend these over the gels or ointments such as Silvazorba Hydrogel. They tend to macerate the tissue. This one is a dry product. It gets absorbed by the body. It works really great in those chronic wounds, something that's beyond 3 months. Once the drainage has ebbed and decreased, you can use this in combination with aquacel and or hydroferablue if there's a cavity or there's depth to the wound. If there's no depth, you generally don't need that. You can use a dry foam dressing, sometimes gauze or abdominal pad. I initially start out doing this every day, but then I migrate to every other day or every third day, depending on the amount of drainage. Remember, each wound is different, and each person's a different individual. You always have to consider nutrition in a patient that has a wound before using this product. I really do like this. If you have any questions about collagen or collagen products, please let me know. Other options are using collagen powder. I tend not to use these because they tend to be a little bit more expensive and hard to use. You have to apply powder to a wound. This is a sheet. It's much easier to apply. You just rip it off. You put it right on the wound. But if you do like powders, you're fine to do that. I just think this is much more facile to use. Any questions about collagen products such as Collagen Plus, Epiona, which is this one, or Prisma, please let me know. I look forward to our next session. Leave comments for any future sessions that you'd like to hear about. I'm Alan Bienstock. I'm a board-certified plastic surgeon. My expertise is wound care. If you need any help with a loved one in the New York City area, Long Island, Westchester, or New Jersey, please feel free to reach out to me. I can help you or your loved one. If you have any questions, leave them below. Make sure you subscribe to the channel when you get a chance, and please share with all your friends. Thank you so much, and I look forward to our next episode. Bye-bye.